The starting point is elliptical excisions, and there's a few basic things to do there. Because one thing I see frequently in all our surgical teaching classes is people don't tie surgical knots properly. They'll tie slip knots, they'll tie granny knots. It's because they've never been shown what a surgical knot is. So it sounds like a very basic, fundamental thing, but in actually tying a surgical knot, there are some simple little techniques to make sure you're tying a knot correctly. Why does it matter? If you don't tie a knot correctly, the wound comes undone. The knot slips, the wound opens up, you get worse cosmetic results. So even just basic knot tying is something to make sure you're doing it correctly. How to excise the skin. It's not necessarily intuitive as to what all the minor features are for how to cut the skin. Having a vertical cut rather than an angle, how to stretch the skin, all those little things are just little tips and tricks you have to pick up at the very beginning to do better work. How deep do I cut? How wide do I cut? They're all little things to make sure you've got the right information as you're starting this expansion of your skin cancer services. What materials do you use? Have you got the right sutures? Does the practice provide those? Are you doing deep sutures? Something as simple as learning how to do deep knots and then how to do them well can make a big impact for your surgical results. But if your practice doesn't even invest in buying some absorbable sutures so you can't do deep knots, well, there's a starting point. Something as simple as that.